Welcome to Raw Online. Today we are going to see on sample size calculation. Okay. So whenever you are planning to do a study, you should know how to calculate your sample size, right? So for cross-sectional studies, the formula is sample size n is equal to z square p into 1 minus p divided by d square. Okay. Let us see these things in detail. But before understanding these terminologies, we need to know what are type 1 error, type 2 error, power, alpha error, beta error, outcome variability, precision and prevalence. Okay. So we'll see these things and then come to sample size determination. Type 1 error. Okay. So from now on, whenever you think of type 1 error, this picture has to come into your mind. Okay. So you believe that the earth is this kind of square. Okay. When it is actually not square. Right. So this is called type 1 error. You believe something is true when it is actually false. Okay, you say that the earth is flat or earth is square when it is actually false. Okay, this is type 1 error. So understand, you need to think of this particular image. Okay, because it's very easy to get confused between the type 1 and type 2 errors, especially in your exam, right? So type 1 error, this picture has to come to your mind. Okay, you feel that the earth is square or earth is flat, but it's actually false, right? So this is called as type 1 error. In other words, you wrongly reject a null hypothesis, right? So what are the examples of type 1 error? Concluding a new drug reduces blood pressure when it actually has absolutely no effect. Okay, so it's basically a false claim. Diagnosing a patient with diabetes based on a faulty glucose test when the patient doesn't actually have a diabetes at all. So your interpretation is completely wrong, right? Your conclusion is completely wrong. This is called type 1 error, false positive. Declaring a patient COVID positive for COVID-19 from a PCR test when it was a lab contamination issue, right? So all these things is type 1 error. That's falsely you claim it to be positive. Okay. So now coming to the type 2 error of false negative. A type 2 error happens when you fail to detect something that is actually true. Okay. So there is some true things happening, but you just fail to detect that positive outcome. You just fail to detect that what is actually true there. Okay. In other words, you wrongly accept the null hypothesis, right? Example is missing a cancer diagnosis because the test shows a false normal result. Okay, this is going to be very common because, for example, a patient comes to you with a mass in the lung, possibly. Okay, a chest X-ray is taken and there is a mass, identified mass in the lung, right? When you're planning for a biopsy, if the biopsy sample is not taken properly, if adequate sample is not achieved, or the biopsy sample is taken from the inflammatory zone, then the value or the report could tell there is no cancer at all, right? So missing a cancer diagnosis because the test shows a false normal result. This is implicative of type 2 error. Concluding that a vaccine does not work when in reality it actually is effective, okay? Then also you are falsely neglecting a true one, right? So the false negative. Failing to detect an infection because the diagnostic test isn't sensitive enough, right? So for example, you are planning to do a nasal swab test, okay, to diagnose a COVID test, but the nasal swab was not taken properly. And ultimately, if it's not taken properly, it's going to come to be negative, right? Even in a patient who has COVID, right? So failing to detect an infection because the diagnostic test isn't sensitive enough or it's done in the wrong way, it's called type 2 error. That's false negative. This is type 2 error. Coming to the power, okay. So what is power basically? So what is this shown here? This is primarily to make you understand, dear friends, okay. This is a magnifying lens. Magnifying lens has nothing to do with power of the statics, but this is just to make you understand, okay. The more powerful a magnifying lens is, the more better it can identify particles below it, right? There will be small organisms, right? If the magnifying power of this particular glass is very high, then the chance of detecting those things, those tiny data is going to be very high, right? Similarly, when the power of a particular trial or a test is very high, the chance of identifying all the parameters is going to be very high, okay. The power of the test is the ability to detect an effect if there is really one, okay. High power means few type 2 errors. There cannot be a false negative, right? So high power means false, fewer type 2 errors. This is called power of the test, the ability to detect an effect if it's rightly present, okay. So there's no chance you can miss out it, right? So this can be false negative, less than false negative. For example of power is a well-designed clinical trial detects that a new antibiotic is effective against a resistant bacteria also, okay. a cancer screening program identified most cases of early stage cancer in a population. Because to identify an early stage cancer is going to be a very difficult task, right? So you need a high power in your particular trial or your research to identify all these kind of early stages of cancer. A study with a large sample size detects the true effect of a drug on reducing the stroke risk basically. This all comes to the power, okay?